Well, thank you for coming. My name is Rebecca Xianyang. I am, yay, it's for me. I am a licensed clinical social worker at Loma Linda Behavioral Medicine in the outpatient youth services. So what I do there, I have a group where I have the adolescents who are working on their mental health as well as their substance abuse issues. So it's a 6 to 8 week program, very intense for my youngsters, but it is very effective because we do have the component where we're working with the adolescents as well as their parents. So I love my group for sure. Besides that, I've dabbled a little bit with teaching at National University as an adjunct professor there. So I do enjoy teaching and being able to spread as many tips and tools that I possibly can for whoever is in need, especially in this helping profession. So dabble a little there. And as though I don't have any spare time, like I have spare time, but in my spare time, I also do clinical therapy at Lifestyles Counseling and Consultation. So I'm a busy lady. Lots going on, wonderful family, wonderful friends. And the one thing that I like about life, in my life, is being a woman. I love being a woman. So when I was asked and had the privilege to be able to speak amongst women, I feel really honored and privileged. So just know that I am grateful to stand here today. Not perfect whatsoever, but I'm here. And I'm hoping that this conversation that we're going to have is going to be helpful, something that you guys can leave with. That's ultimately the goal here today, okay? And like I said, I'm not perfect, so I don't have the right answers here, but I'm hoping that it will help. What are we here to talk about? We're here to talk about mental health and substance abuse, the impact that it's having on us as women, and also what resources we have out there, because there are resources. We don't have to struggle, okay? So that's where we're going on this journey. And I appreciate you coming along with me. And know that you can chime in. Give me a yeah, because it's related to you guys, okay? We're having girl talk now, all right? So let's go and let's move on. I'm big on researching different things. I love quotes. And why do I love them? Because they inspire. So as I was trying to look up information that I would share with you guys on women, and how mental health and substance abuse is impacting us and the resources, I came across a couple of things that I wanted to share. One of the quotes that I found by Diane Merrichild, wonderful quote, it says, "A woman is the full circle. Within her is the power to create, to nurture, and to transform." We do a lot with an extra T because we're constantly doing a lot. It's beautiful and an honor and a privilege to be a woman, in my opinion, because without us ladies, let's be honest, the society wouldn't run the way that it does. I got a yep, because that's the truth, right? We carry a lot on our shoulders. We make up the functioning of America. We are the heartbeat of our homes. We're the heartbeat at work. We do so many things. So this is why I found that this quote was extremely profound, because we nurture, we're mothers, okay? We're grandmothers, we're sisters, we're friends. So we learn to nurture and to comfort one another, right? Then there is the creativeness of a woman. We can put an outfit together in a snap, right? Or my hands is one of the most creative things on my body, so I can bake. I can teach with my mind and be creative in how I'm going to get my approach across to you. I can figure that out. A lot of women are talented in the areas of writing. We have a lot of journalists. We have a lot of singers. We have a whole lot of artists. Women definitely are profound in that field of creating. So we create as well. But the one that I love the most is that we have the ability to transform. What a responsibility and a privilege we have to be able to do that. So that means I can pick up something and I can change it completely. So maybe it was dysfunctional at first and wasn't quite the way that it should be at first, whether my children are having problems or my husband or maybe myself. I can start one way, but as a woman, I have the power to transform it, to change it. What a privilege we have as a woman. So yes, we have our trials and tribulations, but it is wonderful to be a woman. We come in all shapes, sizes, looks, smiles. We come in different packages. But ultimately, in each package, it's powerful in there. It's like if you open the Pandora box, you really don't know what you're going to get in every woman. So, found that this was wonderful. Like I said, it's a privilege for us to be a lady, right? However, as beautiful as we are, we're really walking around like dead women walking. Okay? We know how to put on a good facade. I can dress you up real good. Go get the Mac real fast and go put on my skirt and my heels. And I'm popping off, going about my way, taking care of business. But really, I got a whole lot going on inside of me that I cannot share simply because it's not looked upon really well if I share what's really going on inside of me as a woman. Why? Because I'm strong all the time. I need to be strong. I have to be strong. So I can't really share all of the deep stuff that's going on with me because people will view me differently. But today we get the luxury of being able to talk about it. This is our day. I don't know about you, but I'm glad that I have a forum to be able to talk about the real girl stuff, the lady things that we go through, that we can't share with men because they can't relate. Like they say, women are from, what is the saying? Men are from Mars, women are from Venus. It's very true. We're not the same. That doesn't mean we're totally different, but we're not the same. So our stuff that we are holding inside needs to be acknowledged and validated because it's our stuff. So we get to do that right now. Let's talk about what's really going on with us as women. What are some of the things that we struggle with? Now, obviously, if it's pertaining to you, you can give me an amen or a yes, you are right or something because this is something I hope is relatable, okay? Number one, stressed and overwhelmed. Oh, my God. Hey, and an amen off the top. Why are we stressed and overwhelmed? Because we are 1,000 things at one time. We have to multitask at birth. You come out as a woman, you got to learn how to, okay, I got to feed the baby. I got to do this. I got to get my husband. I got to do myself. I got to go to work. I got to deal with the people. Then I got to come home, still deal with the kids, still deal with my husband. Then me, maybe the dog come before me because I got to feed the dog too because my husband didn't do it. La, 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 la. Okay? I'm stressed. I'm overwhelmed because of the various roles that I play. And then who's taking care of me in the process? Nobody. Stressed and overwhelmed. Got an amen on that one off the top. Then we have body image issues. Right? We talked about this at the office amongst the ladies, and it's wonderful because you can go into your work environment, and many times it's going to be full of ladies, right? We are the majority, not the minority many times. So we've talked about many times body images, and we all struggle with it, whether it's the pooch, or whether it's on my breast, or oh my God, my thighs, or they're spreading. Jesus. Okay, Jesus, take the wheel right now. The pants is not fitting. They're not going all the way up, all the way. Oh my God. Maybe I should just wear leggings for the rest of my life because they are forgiving. Okay, so body image issues. And where does that come from? The media. It's the one place. Okay, the typical size that we see on television is a 0. Okay. And it's unfortunate that we have forgotten some of the most beautiful images that we have had, that we've honored in the sector of women, is Marilyn Monroe, right? When you really think about it, Marilyn Monroe was a size 14. She was not a 0. So it just shows how much the images have changed over time. And so us as women, now we're seeing a much smaller lady, and so we're associating that with beauty alone. And that's definitely affecting us average women. And I can definitely disclose I am a 14, 16. So, I'm Marilyn Monroe size, so I thought I'm doing good. But that's still not looked upon quite well because we don't see that quite often. So we walk with body image issues because of that, okay? And it could be based on what we hear. We could have been told, you are so fat. You're fat. That's gross. You look gross. All that does is definitely feed negativity inside of me and affects how I see myself. Okay, body image. Now, that'll lead me to having low self-esteem and low self-worth. I'm not even good enough. Why? Because I don't even look good. Maybe I'm not thinking right. I'm not where I should be. So my level of worth changes, and that's something that I walk around with daily, not feeling good enough every day. And then if I don't feel good, that definitely bleeds into how I function and I treat other people. Okay? I don't look good. I don't feel good, so I'm not going to treat you good. I'm not going to treat myself good. So we struggle with worth, self-worth for sure. Guilt and shame. This is a big one for women. Why is it a big one for women? Well, there's a lot of women right now sacrificing themselves in order to get progression and success. Now, how do we translate that into regular language? So it's a whole lot of strippers around here who are walking around having to do that job, that demeaning job or degrading job, because they're in school. Or because the baby daddy didn't bring me the check to take care of the babies. So I got to do what I got to do so my babies can eat. So whether it's on the pole or if I have to walk down the street and catch a John or two, I got to do what I got to do. Do I want to do that? 9 times out of 10, no. Who really wants to do that as a woman? So you walk around with guilt and shame for what you have to do to get by. It takes a long time to forgive yourself for some of the things that you've done too. That's not an easy task, nor it is an easy process. So guilt and shame is definitely something we harbor inside of us that's never talked about too often. We judge before we talk about it. We'll talk about that stripper she's a hoe. She's a hoe. Before we ask her, why do you have to do that to get what you need? What is it that you need? There's that. Now, this one here, difficulties with soul ties with men. Have mercy on our souls right now. Okay? What does this mean? For every man that you've had in your life, you're connected to him somehow or another. Even if I'm not physically with you, doesn't mean I'm not tied to you. So the emotions that we have in each relationship, they do fester, they do connect. And if we don't deal with the situation, then we will carry it to our next relationships with men and men and men and men and men. Those faces in this picture are different men that we have dealt with or chose not to deal with, but still dealing with. This is a strong area for us women that we harbor because we are emotional creatures. Our love language is different from men's love language. And so they may not be tied to us the same way that we are. However, we need to work on what connection we still have with our men, whether we leave them, whether they go, or whether we stay. We need to work on our difficulties that we're having with the soul ties to these men. Now, this could be soul ties relationship-wise. It can also be soul ties to your father that you haven't quite resolved that's affecting you too. Okay? It could even be with your siblings, your men in your life, that you just haven't quite dealt with the stuff or the hurt that you feel or the pain that they've caused. You haven't expressed those things, and so you're holding it, but you're still strutting. But we're still holding it. Big, 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 big one for us as women. Now, that's for us women who have the men in our life. But what about us ladies who are single? And I got an amen. I knew it was coming another one. Because there's some of us that are single and are struggling with a lack of companionship in our lives. Not every woman wants sex. Not every woman wants sex. But we love companionship. We love intimacy. And when we don't get that, it definitely affects us. Because who really wants to sit on the couch by yourself with Haagen-Dazs? Like, really? That's not the way. You want somebody to talk to or to say, oh, you're pretty, or when you're not feeling pretty. Or, what do you need? I'm right here for you. When you don't have that companionship, it can be very lonely and depressing. And you find yourself isolating and withdrawing yourself simply because you have nobody or don't think nobody wants you. That's not a good place to be. I'm depressed and I'm lonely and I can't do anything. There's nothing stimulating me to make me want to be a better me. Loneliness and depression, that's a big one. Like I said, we are the majority, not the minority, ladies. We are the majority. So there's a whole lot of us and a little bit of them. Okay? And the quality of many of the men out there today is not the best. I will leave it there. And an amen again. That leads me to worrying. We are worry-warts. Okay? Women worry about everything. We worry about money. We worry about family, kids, and husband. We worry about competing with other people, other women, because I know you're looking at my outfit. I know it. Oh, thank you. But what I do know is that we can look at another woman and say, oh, that's cute, but then, okay, for real, let me see if I can get my situation together, because obviously I need to look better than that or come close to it. So we're constantly competing and judging ourselves to one another as women. Then there's the component of us competing with men, because let's be real, we are in a male-dominated world. We're constantly having to compete with the next man to do the exact same thing. Exact same thing. Women are paid 78 cents less than the man. How sad is that? When we are partakers of holding up this society, we're not seen as equals. So we worry about that. Can I get the next promotion so that I can get the money? So that I can get the reputation so that everybody can respect me? We worry about that too. Worry about respect. Okay? So worry. Anger and frustration. This is the one right here that gets me. I'm about to do an amen and it'll probably fall out because the anger and the frustration gets me. The question that I've asked myself as a woman is, why is it so hard for me as a woman who's really a great woman to have to struggle as much as I'm struggling? Okay? So why am I having to deal with this in this manner? Simply because I'm a woman? How frustrating is that? Or I'm not getting the help that I need at home? How frustrating is that? And how angry does that make you? When you work all day and then you have to come home and still clean and cook. Amen. And an amen. Thank you. Struggling with trauma and abuse. This is my people who are, my ladies who have been victimized by sexual assault, emotionally, physically. Okay? It's a lot of victims that are walking around too. Maybe you were abused as a child. Maybe you were molested. And you can't talk about that. Why? Because will they even believe me? I don't know. Addictions. I'm not just talking about drugs and alcohol, ladies. I'm talking about food. I'm talking about shopping. Come on, Jesus, because that's a good one, right? Shopping, things of that nature. You can be addicted to things in order to fulfill happiness. Now, once again, why are we talking about this? It's because it's affecting us. And the research is showing that mental health and substance abuse issues are impacting us women and affecting how we function on a day-to-day basis. So let's just look at research real fast. 1 in 5 Americans experienced some sort of mental illness in 2010, according to the Substance Abuse and Mental Health Service Administration. About 5% of Americans have suffered with some type of severe mental illness. So 1 in 5, that's a big number, if you ask me. Okay? The next one is here where we come in as women. Women are more likely to be diagnosed with a mental illness, much more than men. So 23% of us women are diagnosed. That's a lot of women. When we consider like the number of people, the population in general, that's a lot of women that are suffering. Now, why are we diagnosed a little bit more? Because maybe we're much more symptomatic than men are. Men don't express what's really going on. We do. So, of course, we'll be the first to go to the counselor before the man does anyway, which is why we are more likely to get a diagnosis. Makes perfect sense, right? Then there's substance abuse. Why do we attach the two, mental health and substance abuse? Where the correlation is, mental health means, or it is referring to, your emotional and psychological well-being. Okay, that's what mental health is. So if my emotional and psychological well-being is not good and I'm not stable, then how do I get it stable? Sometimes I need to self-medicate, which is where the substance abuse comes. Because I'm picking up wine now, a little bit more, because the Stella Rosa is calling me a little bit more, okay? Or I'm smoking, okay? Or I'm using heroin or meth or whatever to ease the pain that I feel, to deal or cope with the emotions that I'm having, the mental health portion that I can't get under control. That's the correlation. So substance abuse is, yes, definitely rising. When mental health rises, substance abuse is right behind the corner with that. This is why we have to talk about it. 23% of us as women are suffering. This is why we have to have this conversation. Warning signs, definitely things we need to look for. Because when your mental health is not okay, it's going to affect your level of functioning. Do not be in denial about that. Pay attention. Your body tells you stuff. Your situation tells you stuff. So what are some of those some of those things that affects or shows us that we need to get some help? Okay, let's just run through them really fast. Warning signs and symptoms. Eating or sleeping too much or too little. Okay? Going to the refrigerator a little bit too much, not eating enough. Pulling away from people and usual activities, so I'm withdrawing, I'm staying away. Don't call my girlfriends no more. It's just me and the covers. Low energy, no energy. I'm tired. Women, we good at that's our line. I'm tired. I'm so tired. Feeling numb or like nothing matters. That's ambivalence. Who cares? Whatever. Having unexplained aches and pains, so the body starts telling you stuff. Okay, my back hurting. Why does my leg hurt when I get up in the morning? Or my neck, the tension. It's great. Okay? Then it's feeling helpless and hopeless. I'm not going to get anywhere in this life. There's nothing that's going to help me get away from what I'm feeling. You start feeling this way, and then that starts bearing over your day. Why should I go to work? For what? Smoking, drinking, and this is the key, or using drugs more than usual. Okay? The smoking and the drinking, we already know what that's talking about. But the more than usual with drugs. Ladies, we use a lot of prescription drugs sometimes. We are good on that Motrin. When them cramps get to going, I'm going to pop that 800, right? But then I can find myself popping it a little bit too often. The Valium, the Xanax, when I'm having my anxiety attacks or just feeling anxious. Taking it more than I should be, more than prescribed. That's a sign and a warning. That's not okay. Then there is feeling unusually confused, forgetful, on the edge. Lord, angry, upset, worried, and scared. Definitely signs that something's going on. I'm on the edge. As soon as somebody says something to me, what? Experiencing severe mood swings definitely can cause problems in your relationships. You going all haywire on your husband, it's definitely going to strain your relationship. I'm displacing my anger out on him. That's not good. I can get divorced. He doesn't have to stay with me. I can't treat him bad. I shouldn't. But I do. Having persistent thoughts and memories that you can't get rid of out of your head. Okay? The mind going consistently. There's times too when I could be in the bed and my mind is going all night and I can't sleep. Find myself with 1 or 2 hours of sleep. Really, sleep deprivation is not a good thing. It's definitely going to impair my function. I'm not going to be able to focus the way that I should as a therapist. So, there's hearing voices even. Okay, some people are having auditory and visual hallucinations. They're seeing and hearing things. That's another warning sign. And they won't admit it, us women especially. Thinking of harming yourself or others. This is the self-harm, ladies. We have cutters. Okay, we have substance abusers. We have even people who are trying to commit suicide or have a plan to do so. Whether it's hang themselves, whatever, shoot themselves. We hear it all. We hear it all at Loma Linda. Now, and lastly, you're unable to perform daily tasks and functioning. So, I'm just taking me a long time to get to work. I'm late to get my kids to school. I can't function on a day-to-day basis. I'm not cooking anymore. I know, Mom. You're not the only one. But there is hope for us all. Because with all those signs and symptoms, my God, we might as well just, right now, all dig a grave and just jump in right now. Because it seems very bleak. I'm here to bring you hope. I'm here to allow you the opportunity to know that you don't have to stay in that situation. Ladies, we don't have to. We can choose to overcome mental health and substance abuse issues. How? How do we do that? Let's keep it real simple. Connect with other people. You got your family there. You got girl time that we choose not to do no more, but we still got the girls. Okay? So we got girl time. We got even church. Wonderful place to get some encouragement, some inspiration. Okay? Then with the community, the Inland Empire is doing it. We got lots of resources. The booths out there show us that we have a whole lot of people out here that's willing to help us. So connecting with other people. Get the professional help you need. This does not mean you are crazy because you need to go talk to somebody. Go to a therapist. Go see a psychiatrist. Go to NA, AA, whatever, support groups. Anything you need to get the help you need, do that. And ladies, if you know a friend who needs it, advise her as a friend. I am my sister's keeper. Why am I my sister's keeper? Because I am my sister. So of course I'm gonna tell my girlfriend she needs to get some help. And maybe I'll go with her to the support group to show support. Then develop and utilize coping skills. What does this mean? I gotta figure out how can I cope and deal. Because mental health and life, it's not going away. So I gotta learn how to deal with it and cope. Gotta develop my own skills. And my skills are my skills. What I tell you, it's not gonna work, my stuff may not work for you. So, little TLC, tend to love and care on yourself. Go get your nails done and your toes. Go get your eyebrows done if that's your thing. Whatever that TLC looks like, or Glen Ivy, or do it yourself, something. TLC. Journaling, we have writers. Write. Exercise. That's a hard one, I know. Just do a little at a time, one day at a time with the exercising. And I'm preaching to me with that one. Art. Like I said, we're creative. That was what the quote said earlier. We're creative. We do lots of things. So get out the pen and the paper that you probably are dusty. It's dusty in the garage. Get out the paints. Get out the pastels, whatever that you used to do. Get it out, because it's going to help you get that stability you're looking for. Helping other people. but with balance. But with balance. But with balance. Okay? I can help other people. Why? Because it provides me the opportunity to have some insight on my own situation. Maybe if I see them struggling even more, it's going to make me say, okay, mine is not that bad. So maybe I can push on a little bit further. But the with balance is the key, because I cannot help you unless I'm helping me. So do this with balance. Help other people with balance. And the one that I love the most is staying positive and maintaining hope. And one of our kids broke down hope for us at Loma Linda. Oh, that's my timer, so I'm almost finished. See, I'm doing good. And what the acronym for HOPE stands for is holding on to the notion that pain will end. If you go into treatment with that mindset, you are more likely to be successful. The pain is not going to end automatically. The stability is not going to come immediately. But what I need to do is be optimistic, see that cup full, keep pushing, and hold on to the notion that eventually if I work and keep working at it, it's going to eventually end. It's going to eventually end. So hold on to your hope. To me, it's really what's going to help you to overcome mental health and substance abuse struggles that us ladies are going through. I want to leave you with something that I find very dear to my heart and Loma Linda. In group, every time we end a session, we end it with the Serenity Prayer. Okay? I want to read it to you and share this with you and my thoughts about it. Serenity Prayer says, God grant me the serenity to accept the things I cannot change, the courage to change the things that I can, and the wisdom to know the difference. This is one part that we didn't know existed that we love so, living one day at a time, enjoying one moment at a time, accepting hardship as the pathway to peace, taking as he did the sinful world as it is, not as I would have it, trusting that he will make all things right if I just surrender to his will, that I may be responsible, reasonably happy in this life, and supremely happy with him forever in the next. Amen. Amen, and that means we agree. Now, the parts that I highlighted that mean something to me, we all need the serenity to accept the things we can't change. There's parts that we just can't change in this world and about ourselves. But the awesome part is, God, I just want the courage to change the things that I can, because we have the ability to change some stuff. We can transform. All we need is the courage, the wherewithal, the bravery to face that journey ahead, to change it. And the wisdom to know the difference, because I need to recognize between the two. What can I change and what I cannot? That's why that's so profound, because we need to be able to know the difference between the two. And lastly, living one day at a time. And I highlighted that simply because you cannot see your journey. You cannot think that your journey is going to be fixed in a day. Rome wasn't built in a day. It takes years. It takes years. And that's okay, because you got hopefully a support system that's going to be able to walk with you through those years. Take it one day at a time. One day at a time. I hope something that I've said has been inspirational and powerful to you. And if anything, know that you're not in the struggle by yourself. Loma Linda definitely has wonderful, wonderful resources and services for us women, and not only for us women, but for our families, for our children even. And know that there's help out there. We don't have to succumb to mental health and to substance abuse. We have the ability to nurture, to transform, and to create. So I hope that you find your true best self and reach your true potential, because you can, and you're beautiful. So if you haven't heard it today, you're going to hear it from me. You guys are beautiful, and you have the ability to change whatever is going on in your life, and know that there is help. So I appreciate your time and your attention, and thank you so much for your participation in this breakout. Thank you.